How are
Hi, David.
you?
Hi, Sean. I'm good. How are you?
Good. Is there a delay?
I don't
Yes,
hear it.
I think there
Am
is a
I
little
okay or
one.
is there?
I think it's on my end.
Okay.
It's fine. It's the Malibu Wi-Fi.
All right.
It's so nice to see your face. So,
I
for
know.
people
I
who are,
miss you.
I know it's been a month too. For people who don't know, Megan and I were supposed to be in a wedding together tomorrow in New Jersey. So, this week and next week, I think, is like everybody from the wedding party is coming on at some point and all chatting about our professional lives. So I like it. At least we get to see each other's faces.
I know.
Oh, excellent. Well, let me introduce my really, really great friend, Meghan Helwig. Again, my name is Heidi Gassler. I'm the owner of Mountain to Sea Physical Therapy. And this here is Dr. Meghan Helwig, and she has a practice down in the San Diego area. If you could tell us a little bit about yourself, your practice, your teaching career, that'd be awesome.
Awesome. Thank you. So my company name is Primal Strength Physical Therapy. Actually created it when I was still living on the East Coast. So Jersey girl. Started in finance, made the switch, worked outpatient ortho for about 7 years before I switched over and kind of got sick of the grind of 20 plus patients a day and opened up my own office. Kind of started a little bit in golf performance and then moved into an office in a CrossFit gym. So started out more ortho sports, working with my athletes, and then just the everyday, weekend warrior, anyone that just basically wants to be active. And then eventually knew I always wanted to be out here. You and I, what was it, like 8 years ago, out here with my level.
Longer now.
Yeah,
Yeah.
maybe like 10 years ago. I don't know. Yeah, probably 8 to 10 years ago, I came out here for a TPI course.
Hmm.
Like, why don't I live out here?
Yes.
So eventually knew I wanted to be out here. Packed everything up, 2000, I think, 16, and opened up an office in a CrossFit gym. So I have a small office in a CrossFit gym in Carlsbad. So I see a wide variety of patients or clients, golfers, triathletes, CrossFitters, just runners, anyone in general that has any kind of, orthopedic issue that kind of comes up. And then probably 2 or 3 years ago, I got asked to start teaching for Rocktape. So I
Yay.
get to, I know in my head when they asked me, I think I said no way in hell. But yes came out of my mouth somehow because I used to be scared to speak in public, like was petrified to speak to groups. So it's something that got me out of my comfort zone and realized I have a passion to, teach others. Because I mean, we're all in this because we want to help people. And
Hmm.
I realized when I teach, I get to help even more people because I can help other providers,
Sure.
give them techniques and just confidence to work with their clients in different ways.
And that's such a cool thing because you're now not only you're taking your umbrella and spreading it so wide because your expertise is getting taught to all of these other people who then in turn can be teaching. And it's a great thing. It's such a widespread global effect.
I know I never would have thought I'd been here, but it's been the best thing that's happened to me probably in the past 3 years. So I'm grateful for
Oh,
Rocktape.
that's awesome. And people like Rocktape isn't sponsoring this post. We just both really like the product. Obviously, Megan teaches for them. I feel like I
Yes.
say this a lot. It's like, this isn't a plug, but Rocktape, if you want to send me free stuff, I'm not going to say no because I'm down to the really basic beige tape now. And I'm like, I need some fun stuff again,
You need
people.
the new neon,
Um,
glow in the dark parties now. No.
yeah, I'm like, I need the glow in the dark, like the super neon. So as soon as I actually have a tan
Yeah.
at some point. I'm like the same color as the wall behind me right now. Anyway, so let's get down to it. So this week, the topic that we've been kind of exploring is on breath work. We've been started exploring that with Kimmy Moss on Tuesday, on posture and rib cage, thoracic spine mobility with Janet Alexander on Wednesday. And then Megan has been so kind to come on to kind of help to wrap up our series because questions that we get in the clinic and that I get in the clinic often is on self-treatment. I've got these exercises, but what are other things that I can be doing to help to kind of round out a home treatment plan? And things that we work on often here is how do you implement things like tape? How do you implement things like cupping, soft tissue work? And since Megan teaches all of this, I asked her to come on and be our instructor today in some taping techniques to help us towards our weekly goal here of breathing better, having better posture, kind of down regulating our CNS because we're all so overly stressed right now. And down regulation just meaning that we're kind of lowering our stress level a few notches, calming ourselves down. All of this to help to bolster our immune support because that's a really important topic for us always, but especially right at this given moment. So with that being said, what would you like to start with? Do you want to start with taping? Do you want to start with cupping? Do you want to start with tools? Like you pick.
Probably maybe an overview of all of it. Because like,
Okay.
I think the biggest thing that happens whenever you use any type of tool is your intent. And the intent when we're doing it is to teach us something or to facilitate some type of change. So biggest thing we're trying to do is the tool, the cup, the tape, it's touching the skin. Whenever you're touching the skin, it's feeding information to the brain. So biggest thing is it's the brain that's making a change. The brain's dictating what's happening. It's just we're giving it information through our skin. So I like to teach like my clients, other attendees, that our intent is going to be important. So say you're using tools, the way you use the tool is going to be important because you're feeding information to the brain. So depending on your rate and how heavy you go, you could feed different signals to the brain. So you could confuse the brain if you don't understand what you're doing with the tool.
Sure. Instead of down regulating, you could up regulate.
You're tapping into receptors in the tissue. So basically you're feeding information. So what's your goal? If we think about our stress levels right now, we think about breathing right now and how we start to get anxious. We start over breathing up through our chest. Next thing you know, our shoulders are up by our ears. The areas that tend to have higher tone because they're overworking could be, you know, our posture when we're working from home. So pec, upper trap, around the border of the rib cage, because when we're breathing, if we're all up in here, you might see a little rib cage flare. So on all those areas that you want to like down regulate or relax the tissue, you want to be going slower with a tool. And you don't want to like go to the point where you're like causing pain, because if you think of what's happening with pain, you're going to tense up and tighten more. Some people
And I think that's super important.
Yeah,
oh, sorry.
So,
That's such an important point because so many people are taught or think that with like a tool like this, that like and we can talk about this with the taping later, that like more is better. You know, that like I have to create pain with this thing in order for it to be, be effective. And like, that's something that's really a misnomer, I think.
Oh yeah, because they're like, oh no, but it feels so good afterwards. Well, yeah, it feels good afterwards because the threat's gone. Like you're hurting and your brain's like, okay, they stopped. I'm safe now. Now I can relax, and that's why you have that positive effect afterwards. But you rather have it during, and not have to go through that torture. So one of the ones I love doing, like if you're doing self-treatment, I mean, you could go in and just do kind of like a self-stretch, but I don't know if you guys can still see me here because I just sat down.
Yes.
But just
no, you're great.
On and just going in and like a downward, deeper and slower type of pressure. So when you're going deeper and slower, that's going to be tapping into Ruffini receptors if we get into the science and behind the brain to relax that tissue. So that's more of a tone. So it's more of a tone issue. So that's the brain then dictates the outcome. So if you want to think about relaxing things, go deeper and slower. If it's an area that maybe we need to improve our breathing down lower, we need more awareness here, I'll switch how I use the tool and I'll go like a lot faster and very light. So going light and fast.
Light and quick.
Yeah, so it has to be over 200, about 200 beats per minute. Like I'll actually get a metronome out when I'm teaching, and so you can hear that rate.
Sure.
And it can be super light too. If you're just trying, say you're post, C-section or abdominal surgery, and there's trauma to an area, there's probably also guarding and a lack of awareness in the brain of that area. So even just turning a tool flat and going super light and fast, we call it the feathering stroke. That's just connecting that part of the body with the brain and kind of reconnecting it there. And that's also for pain because, whenever we bump something, we kind of rub it.
Yeah.
It's kind of, we're disrupting the pain signal to the brain.
Sure.
So basically,
And so that you're not digging at all. That's just literally
not
like,
at all.
oh, okay. Now question,
Yes,
are you going stroking down and up there, or are you going just one way?
Oh no, I'm going all different vectors. So you can change
Okay.
the direction as you're doing it. Because think of it, all our hair follicles have receptors in them.
Sure.
All the hair follicles, sometimes the hairier the better. You're tapping more receptors. And it doesn't hurt as much. If it's tape, that's another story. And if it's pods, it doesn't stick as well. But I want you guys thinking, like, you can stack a couple different strokes. So if it's something that's like acutely painful, I'll get in and start super light and just do this to kind of like, and often if you're coming at a client with like a tool, they might be scared of this. Like sometimes you just need, you're like, okay, go face down. No.
Yeah. People are like, wait, what are you doing with this? They look scary.
Yeah, I know. And that's the biggest thing. Like we need to feed safety to the brain. Like we need to feed a lot of times movement dysfunction, pain is our body's way of saying, hey, I don't feel safe. Hey, there's some kind of threat going on. So even just using these tools to kind of bring more awareness back to the area and help the body feel safe, that alone, you can have huge changes. And a lot of my clients are shocked when like even just a little bit of a light touch and just reconnecting that area to the brain, they're like, oh, I'm feeling better. And it's just like you're reconnecting that picture. It's like a GPS system. Like if I use the analogy that you're in like a parking garage and you're about to exit and you don't know if you have to go left or right, and it's saying acquiring signal, like doesn't know which way to go. You're like, I have to turn. Where do I go? Like you don't have clear signal. By using the tool and just bringing more awareness back to an area, we're cleaning up that signal. So we have more options to navigate like movement.
Great analogy.
Yeah.
Question, are you using any sort of lubricant while you're doing this or no?
It depends. So you don't have to. It depends on the person's tolerance. If it is, and I will change the angle too. Like if I stay a little lower, it's not going to be as noxious. If you want to get the perception of going deeper, I actually just change the angle of the tool. Sure. If I want to tape that area, I'm not going to use lubricant because then it's going to take a while for me to have to clean all the oils off. Yeah. The other thing we'll use though is the Rock Sauce Fire, which actually has menthol in it. I'll use that as the lubricant with the tool because it's also a tissue prep for tape. So you can tape right on top of this. That's great. To save time, I'll use that as my lubricant if they're okay with the menthol.
Okay. Is there a Rocktape Rock Sauce that does not have menthol in it if people are smell sensitive or sensitive to menthol?
I don't think so. I just have like the only thing I have, which I end up using, is like a cocoa butter or something, but that has the oils in it.
Sure. And that's hard to get off before you tape.
Yeah. So if I know I'm going to tape a certain area, I just won't use it, but I'll use it on other areas.
Got it. Okay.
Yeah.
Can you show us specifically something for mobilizing the diaphragm? It's like the people are really familiar, like, okay, this is my pec, this is my bicep, this is my upper trap. But a lot of people just don't understand what the structure of like the diaphragm looks like and the fact that we can actually access it through this front area to release it. And something we've talked about in the other talks this week is about how diaphragmatic tension makes it harder for us to get a good deep breath. And also for our purposes, for a lot of people who might be watching this, it also provides a lot more downward pressure than into the pelvic floor. And I know that's something that you and Janet and I actually talked about last week about with a specific client, is that diaphragmatic pressure then can actually drive inner abdominal pressure down into that pelvic floor in a negative way and maybe creating some more pain issues. So can we talk for a minute, like one specific thing that you might do for diaphragmatic release with the tools?
So I actually did this yesterday.
Mm-hmm.
So my one client who was having testicular pain,
That guy.
I didn't even have to go anywhere lower on him to work even down lower. I just went all up along the border of the rib cage, and I would
Mm-hmm.
have him like take a breath in and have him like, so when he took that breath in, my fingers would almost pop out. And then on the exhale, I try to get in and under
Mm-hmm.
along that border. I kind of go back and forth with using a tool or just using my fingers.
Sure.
For at home, it might be hard because at home, you don't want to like get ab tension. You want to be able to be relaxed. So for him and his homework, hold on, I'm just going to move this a little bit to see if you guys can see me there. His homework was going to be like getting here, slouching, getting your hands like on the border of the rib cage. Take that breath in. Hopefully it kind of pops your fingers out because you're actually breathing from down here, not up here. And on the exhale, just slouch, and you're almost trying to get your fingers under the rib cage.
Sure.
If you're trying this at home, you will find it's just because of the nature of our organs, it's going to be a little bit tighter on that right side.
Sure. Stomach's there. So
yeah, but I'll work all the way around. So yesterday I had him just laying flat, and I would have him take a breath in, and then I could get in a little bit more if someone else is working on you, and when he's totally relaxed. The other thing that I do as a self-mobilization, and I use it, the tune-up, yoga tune-up, is the courageous ball, so it's smushy.
Yes.
And I actually get on my belly with that. And I'll just go through and do some belly breathing, but on that exhale, really let it sink in. And I'll go around the whole border. I'll even get like posterior diaphragm. So there's different tools that you guys can use to kind of get in there. So if you have any kids at home with like soft, kind of like a ball, just going around the border of the rib cage and working on, so that's one, you're getting tactile feedback there. So something touching that area is cueing the brain to kind of breathe a little bit lower. And when we were working on that yesterday, that was like, he sat up and all the tension down here immediately was gone.
That's awesome.
On him by only working up higher.
And that ball technique is one of my favorite.
Like, okay, a lot of our.
Oh,
go ahead. Sorry.
Oh no, I was just saying that ball technique is one of my favorite, diaphragmatic releases. Like any of those soft balls. And for people who are stuck at home, if you don't have one of those, like those balls are like available, or similar ones available at like the 99-cent store or Rite Aid. But like at home, I was actually using one of my dog toys, like because it was like a softer, squisher. Oh, I was saying that if you don't have one of those balls, they have similar kids balls at like Rite Aid or 99-cent store. And I actually did that same mobilization on myself last weekend, but with a dog toy, like with a dog ball. So you can get creative.
Yeah. I mean,
did I break up?
Yeah. And you a little bit. Yeah. But it's better now. I mean, even if you have a bigger mobility ball, like a little harder, it's just not as comfortable, and maybe don't put all the body weight on it. That's just going to be some of the other options.
Sure. Awesome. Well, maybe do you want to talk about the rock pods and like some self-cupping next?
And that's something too where some of the cases we've talked about in our cupping course are, I'm like in between heights right here, is using the cups, one for like movement retraining. Like what are we trying to do? Are we trying to retrain a movement? If we think about sometimes some of our athletes or clients that could have like lower cross syndrome, and then their core is not as efficient because they're in that anterior tilt in there, I will actually use the pods for movement retraining. So one would be if we're trying to teach someone how to get into a neutral posture because they're stuck here all the time and they're wondering why their back's always hurting and their core is not efficient. That's something where you can put one pod higher and put one pod lower. And here, now you're just trying to bring them closer together.
Can you show us a little closer, like what those look like? So for people who don't know, I mean, these are these soft silicone cups, and
that will go away in a second.
Yeah, and what Megan's doing is she's putting this on her skin and then she's depressing the top. And you'll see
Yeah.
that that creates this suction that's on here. So now we can move the tissue around and it's actually creating a pull up on my skin here. And
Yeah.
then when you can pop them off.
So there's different ways you can apply it. If you're very sensitive to it, I actually pre-plunge it and then put it on, so there's not as much suction.
Sure.
And then when I'm doing it for a movement retraining, I usually do it that way because I'm not using it for the decompression effect, as more as a cueing effect.
Okay.
If I'm using it for actual tissue glide, so think about maybe, and I hope people do this, is say that they had maybe some kind of scar, some kind of surgery, and that's affecting and limiting maybe their fill when they're breathing. I should take this off so it's not on too long. So if they get on and like maybe they cramp all the time or they get stitches on their side when they're running, it could be actually some entrapment of like a superficial nerve. It could be a tissue issue and not necessarily a muscle issue. So getting on there and seeing, like for me, I can move fine this way. I move fine this way. It doesn't, like, can you tell it won't move down that much on me? Like here,
yeah, it's like you've got great glide up, sideways, but down it's just a hard stop looking.
There's no glide down. So I would actually take this on here. You get good capture. Now I can start to glide with, now I have a handle on the skin, so I can get on the skin on there and start gliding in that inferior direction and working into that resistance. So you can like use this to work on tissue glide.
Hey, Milo.
Hi, Milo. You could use it on tissue glide, but that's something too where I might use some other tools together where maybe I'll use some vibration, a hypervolt or a trigger point gun or something to work on tissue glide first, then get here and work on it that way. Or you can even get the tools out and using the tools do kind of a chopping stroke where you're trying to actually work on tissue glide. It's not really working on tone or anything there. So I'm working on tissue glide through all that. But the nicest part about the cups is maybe, yes, we're getting some decompression under the tissue. So it's, you think of it, using a tool, using a ball is all compressive. The pods is one way to actually decompress and then a glide. So you can get like a differential glide. So I can put this on. Now I can go through some movement. And so I'm getting an internal glide of the tissue relative to an external glide of the pod.
And that's awesome because it's, you're taking that decompression and then you're turning it into a functional activity.
Exactly. Yeah.
So, and that's one of the things that a lot of people don't realize is that, you know, our tissues at rest might feel fine, but the minute that you take those tissues and you actually put them into stress, those tissues may kind of clump down, and it may be that that's an effect of like an old injury, or maybe it's something that you have some sort of other like irritant. And using something like these rock pods that are decompressive, it can actually help you then to take that and functionally decompress yourself. Or like Megan was saying, you can use them to provide more tactile response in order to facilitate more tissue activation. And if you could go back for a second, because I think this is important for our topic. You mentioned lower cross syndrome. Now, you know that what that is. I know what that is. Other practitioners on here might know what that is. But can you explain it for people who like have no idea what those words meant?
Yeah. So if we say lower cross, like if we're in a nice neutral position here, your rib cage is going to be stacked over your pelvis. Lower cross syndrome is going to be when we start to hang out in this anterior tilt. So now you have some shortening of the hip flexors. You have some over lengthening of the core midline. You have some shortening of the low back and some stretching of the glutes. So we're in an inefficient position where overstretch, tight, tight, and now there's an imbalance happening. So this is something where we're sitting a lot, or we could just be a little lazy, and I'm guilty of this being an ex-gymnast. I'm more comfortable hanging on the joints sometime instead of, this takes more work to have a nice like stacked posture. So lower cross syndrome, just meaning, you know, tight hip flexors, inefficient or not as efficient core, glutes not firing as efficiently as they could. So using the pods to retrain that positioning. You know, for our golfers out there too, that's going to be something you might see in their setup. Are they stuck in like an S posture, neutral, or almost into a C posture? So it's something that's going to affect our performance because we're now in an inefficient position because we're not going to be able to utilize certain muscles as efficiently as they should.
Absolutely. And there's a lot of people who are like right now too, just straight up just carrying more stress in that area. It's like a lot of people like know that they kind of carry stress like this. A lot of people don't realize how much stress they carry in their abdomen, in their hips, in the low back. So something like this, you may have not been in this posture, a month ago, but now after a month of being at home, working from a crappy like at home workstation, dealing with your kids while you're working, not exercising normally, a lot of people are having these like changes in their posture that they didn't have before. And these tools are great ways to be able to do some self-treatment at home. And if you guys have questions on what on earth to do with these, by all means, get yourself some, and then message Meghan, message myself. We're happy to teach you how to use these things. And we are both doing virtual sessions. So know that there's a lot of things that you can be doing with all of these techniques that Meghan is teaching us about right now that you can do at home right now. And that's the whole idea of like kind of introducing people to these, that you may not have heard about this. And it's a really easy way to self-treat that you can be doing now. So message us, schedule virtual, and learn how to self-treat. Take a little bit of command over your health right now, people,
Yeah. I know, that's the biggest
like,
thing. It's fun when you realize there's so many other options with the tools. Like it's not just decompression. Like yes, some tissue needs to be decompressed, and we need to get the tissue glide there. And we need to facilitate that bruising that you see is more just facilitating a healing response that's happening under the skin. So yes, if you do have, and I just have to put this out there, if you have a bleeding disorder, if you have open skin, if you have wounds, if you have stuff, if you have a scar that's not fully healed, don't put these on there. Last thing we want to do is to open something worse or cause more bruising if you have a bleeding disorder, or if I'm on massive blood thinners. If you're pregnant, I'm not going to do it around the belly. I'm not going to do it around the sacral area, but there's increased blood volume. So yes, you could maybe decompress along the forearm because maybe you're having a little bit of carpal tunnel and you need to create more space and get tissue gliding better. So there's options and different things you can try and utilize, because so often we're just trying to stretch and mobilize this tissue, but maybe we just need to create more space. So that's something to think about. But there are some precautions when it comes to using tools that we just want to be mindful of.
Definitely. And that's one of the things I think, and I don't know if you see this down there, but I have a lot of people who take just a ton of, like, say, fish oil, for example. And those people tend to bruise more with these types of things. And so it's wanting people to be aware of, like, maybe the things that they're on or other conditions that, like, you should have a conversation with a physical therapist before using some of these tools. Now we have a question. Having some skin inflammation on my hip, butt, thigh area, could that be stress related as well? You want to speak to that, Meghan?
It depends on what kind of, inflammation. Is it more of like an eczema kind of response, which I think could be something that could be stress related. Our body, our stress levels are going to have an effect on our chemistry. I mean, this might be TMI, but I'm going there. Like, I haven't gotten my period during this whole COVID thing with the stress. So I'm normally regular, like on the T 30 days for the past 2 years. And then all of a sudden now all this stress comes in and I'm 12 days over. So it's amazing what stress will do to our body. So taking control of that in any way possible, and knowing that there are going to be huge chemistry changes in our body if we're not breathing properly, right? Like the amount of CO2, the amount of thinking about versus diaphragmatic breathing and actually getting a nice fill, and thinking about your respiratory rate, your inhale versus your exhale in there. So using that to down regulate your system. So I think using breathing could be one thing to start with inflammation in the body. There could be a lot of other things, interactions, medications. Maybe you're in a new environment more than you're used to. Is there mold?
Maybe you're using new chemicals.
Yeah. So that's another thing is how many people are usually using all natural cleaners, and then COVID comes along and now we're covering ourselves in Lysol, wipes, all this other stuff, which we normally don't touch.
Yeah.
Like I was using the Cavicide wipes and I found myself every once in a while using them without putting gloves on. And I'm like, I'm not supposed to be handling this stuff. So now there's a lot more toxins that we're probably not used to in our body.
And our skin is a major absorber of toxins. And a lot of people either haven't heard this or don't know this, but, you know, and Megan, you and I could talk about this on a whole nother thing. Megan and I both use all natural, really clean makeup products, for example, because our skin absorbs so many chemicals, even through like your makeup, your deodorant, and things you put on. And you know, you might be going from somebody who's like that, who kind of is using all these natural things, and then now we're using Clorox wipes nonstop. And you could even be having a skin irritation from something like that. And it may not be just where you're touching them. It could show up on other areas of your body as well.
Yeah, so there's so many different factors right now that are changing for people, between the stress levels, the way we're breathing, our tension in our body, the chemicals we're putting into it, lifestyle changes, new postures with how we're sitting. Our bodies are working in different formats.
Mm-hmm. Mm-hmm. Yeah. And I don't know. And I, you know, another thing too is that a lot of people are using a lot. Yeah. Oh, sorry, you're breaking up just a little bit there. What was that? You're breaking up just a little bit there. What was that? Oh, yeah, sorry. All of a sudden you broke up on that last thing, but and I don't, you know, I don't know about you. Yeah, I'm hearing it too. Yeah, you know there is. I don't know about you too, but one of the things that I've been having a lot of conversations with my patients and clients about is about you know, consumption of alcohol and other things that people are using right now to kind of de-stress. And no judgment, okay? Please don't take it as that, but a lot of people are drinking a lot more, you know, at home right now than they were before. A lot of people are using other recreational drugs and things a lot more than they usually are, and they're coming in and reporting like things like their body odor has changed, and you know, they're noticing that they're having skin changes. And it may not be that they're, you know, drinking or recreational drug use. It might be like you're ordering out pizza more because you're stressed and eating more carbs than you usually, you know.
Yeah.
So
Wes, can you hear me now? I don't know if somehow my volume isn't working, maybe. That's weird. So we will see.
can you guys hear Megan now?
Someone give us a thumbs up if you can hear me. I guess they, okay.
There we go.
Cool.
All right.
If you can't, just go ahead out
Yep.
and come back
Cool.
in. Cool. Yeah, the other thing is too is sugar. Like we just
Yeah.
So for me, like I'm a drinker, but you know, I went through the whole Easter holiday, didn't have any candy, nothing, and then I had that moment of weakness where I'm like, I'm really craving jelly beans for some reason, and had to go. And thank God they have the little small packs instead of the big bag, or I'd eat the whole big bag. But that's something else too, with the amount of sugar that we're putting in our body too, and the type of food. Are you maybe having more processed food now because of what's going on and not wanting to go out and get fresh produce? So just something else to think about. I think it's just a, you know, snowball effect of everything we're going through right now.
Definitely. Well, kind of circling back, let's talk a little bit about taping. We've talked about a couple other tools. Let's talk about this taping. And something that I think might be important to touch on is, with all of the stuff that we've been talking about skin changes, potential hormone changes, talking about maybe what could happen with adhesive right now with the skin, you know, just so people have an awareness and kind of know to look out for it.
Yeah, so biggest thing is if you have an allergy to adhesive like Band-Aids, you're probably going to, you could have an allergy to the tape. So if you know that ahead of time, or if you've never used tape before, I always suggest that you just take a little tester patch and use like a tester piece just to like test and see, especially if you're pregnant or if you're on some new medication. to see if you have any sensitivity to tape. So you can just take a little piece and just put it on, you know, you can always put it on just like the belly or somewhere if you don't want it visible. Keep it there for like a half a day or a day and see if there's any irritation. If it starts to get itchy or, you know, funky, take it off, because that means you're probably having some kind of reaction to it. Yeah.
Cool. Would you show us a taping that you like? Because I know that there's a really good one that you have for helping to kind of support that posture that we've talked about, support like our diaphragmatic to pelvic position, support that front so that we're kind of getting out of that anterior tilt and rib flare. And so we're stacking up well so we can really support our diaphragmatic to pelvic position and support good, healthy breathing techniques.
Yes. So my favorite taping of all time is going to be actually taping the stomach. Even though when I first started doing it years ago, it was actually for back pain. But when you realize it was when I was doing high volume deadlifts or picking stuff up, my form would break down. And where my form would break down was more of that like hinging here, and I was losing midline. So my back was just working really hard and working too much. So the taping I do for bringing more awareness to the core, you know, that posture, you're not going to put any stretch on the tape. So we're not trying to hold anyone in a position. You're actually trying to learn through failure. So you put yourself in your ideal posture, put the tape on with no extra stretch, and then when you fall out of that posture, it stimulates the receptors in the skin and you get some feedback and you're like, oh, I feel a little pull. Let me go back. So you actually learn through failure. So it's actually working on building up that endurance to be able to hold that position. So what I do is I'll just take two pieces. I'll show you guys in a second. Sorry, let me just cut it. So I actually just kind of fold it in half. I round the edges so it sticks a little bit better. And women, just be mindful. For me, I find certain times of the month, my skin might be a little more sensitive, and it could be according to your cycle. So some days I can keep it on just for a workout in an hour or so. Other days I can keep it on for 3 to 5 days. So biggest thing you're going to do here is you're going to get into that stack posture. So if you're normally someone that's standing like this all the time, cue I use is pull your pubic bone up towards your belly button, bring the ribs down. So now when I'm in this stacked posture, I rip off the edge of the tape. So I have an anchor because we never want any stretch on the end of the tape. I'll put it down lower going towards the pubic bone. I actually pull the tape back a little bit here so the paper lifts off, and then my thumb just slides up, and I'm in that stacked posture. My thumb slides up, and you want it to kind of end at that border of the rib cage, because when your ribs start to flare, you start over breathing, you start to get that rib flare, you're going to get that little bit of a pull through the tape. So then the other side, same thing. Rip it off so you have that bottom piece. I just put it as low as you kind of can go safely there. And now I'm going to make sure rib cage is down, pubic bone pulled up. And then I just pull my finger up on that there. Lay the top down with no extra stretch. So you're kind of just pulling it around. So now you have the support here. So you're bringing more awareness to the core. It's kind of helping you stay in that stacked posture. So if I start to get lazy and want to do this, or if I go to bend over and do this instead of a hip hinge, I get the feedback in the front. I add in one extra piece though. So depending on the client, if you're someone that had any kind of abdominal surgery and maybe you do have a scar, sometimes I'll put this piece a little lower just for tapping into the brain to bring awareness back to that area as long as it's fully healed. If not, I just go an inch or two below the belly button. And this piece is just to facilitate increased awareness to the transverse abdominis and breathing down into this lower area here. So I'll take the piece in half, rip, kind of pull back. So now this is where I'm going to put it on. So I kind of have handles here. I'm just going to go below the belly button, no stretch on the tape. And then it just kind of comes around and up a little bit, because we should be able to breathe into this area here. A lot of times this is where people have difficulty breathing. All right, so here and up. So now I call this the happy core. So it's like a little smiley face on here. So it's going to facilitate, you know, when I do this for any workouts that have a ton of deadlifts, my back does not hurt because I'm actually more aware of my core and my posture. A lot of the research has showed that actually tape works really well and brings more awareness to the area when you're under fatigue. And that's usually when our injuries happen, when we break down, it's usually under fatigue. So having the tape on there is bringing more awareness to that area when we're doing something where we might be getting fatigued.
And that's just a great point, because like we've been kind of talking about, all of these tools are bringing awareness to areas. It's helping to re-educate, you know, this is all kind of re-education tools for the body. And so this tape you're not relying on it to be like a back brace. It's not taking the place of like a weightlifting belt, but we're helping to re-educate. So if we've got somebody who's in this, you know, posture, it's increasing postural awareness, but it's not increasing dependence or reliance, which I get that question a lot. People are like, well, I'm going to get stuck using this. Like, no, you're not. This is something that's going to help with re-education, but it doesn't mean that you're going to become reliant on this thing.
Yeah, no, and it's making you work from the inside. Like it's bringing it's an external cue, but it's you're learning through either failure when you cheat or go out of that position. It's teaching you where you are in space. So it's proprioceptive too. It's helping you be more aware and learn your own body mechanics and becoming in tune with, you know, maybe I need to breathe more down lower. Maybe I need to feel that fill into that lower quadrant where the tape is. Or maybe I need to work on that skin glide there because it's not moving that well. I wasn't even aware that the tissue wasn't moving well there. So there's so many different things you can use the tools for. And as we said earlier, it goes back to our intent of what we're trying to do with our client. Is it for pain? Is it to change movement? Is it to increase mobility? Is it to increase stability? Where the tape is really going to help with stability and motor control. So.
Oh, that's great. That's a perfect way to wrap this up, is kind of wrapping it back up to what are you trying to do with these tools, and then how do you manipulate them in order to achieve what your intention is. So I think that's a great wrap up. Oh, Meghan, I know that you need to be going here in a minute. Where can people find you so that after this they can find you if they don't already follow you on Instagram or know your web address?
Yeah. So Primal Strength Doc on Instagram. If you go on my profile, there should be a link to my website, but it's primalstrengthpt.com. But just shoot me a message on here or go through to the link, either or just send Heidi a message too. The two of us would love to help any of you guys that have any questions with this. And just different
we love
ways
to work together, people.
I know. I actually did do a three-way virtual last week, which was actually a lot of fun with another practitioner and their client, just to get a different set of eyes on something and a different perspective. Because, you know, when you're seeing someone for years and you're like, I feel like I'm missing something or it's not changing, sometimes you just need a fresh set of eyes.
100%.
A different idea to look at things and just change. Because sometimes it's just more of how we cue a client and we just need to change our words or something.
Right.
It all makes sense. Yeah.
Well, people, for everyone to know this, if you missed this or talk earlier, or missed any of the earlier talks this week or last week, over the weekend, this weekend, I'm going to be uploading all of these videos to YouTube, and I will be providing everybody with links to all of our videos that we've done so far, and we're going to be continuing to do that. So we'll kind of do a wrap up. Meghan, I'll send you the link. You know, anyone, this is going to be an ongoing thing. So after this, if you guys realize that there's questions you wanted to ask Meghan that you didn't get a chance to, other topics you'd like to learn how to do taping for, any of these techniques we've been talking about, if you want to learn for something else, shoot me a message. We're happy to do this again and bring Meghan back on to talk to us about other techniques. And so thank you for your time. And I love you and I miss you. I wish we were hanging out today.
Thank you. I love you and miss you too. So hopefully we can get together soon.
Yes, please. All right. Thank you all. Have a great afternoon.
All right.
Bye.